I think radiology events like this are really important to our industry, and as an industry representative, it brings industry closer to the profession. We can have some really interesting conversations like we've seen today around workforce and how innovation and AI and other technology can really help with the workforce shortages. So I think it opens up that forum for some really interesting content. Okay, I think that AXREM members' technology and innovations can really help the NHS. I've already said in terms of the workforce, but yesterday we heard an announcement from the government around new funding for AI in breast cancer and mammography. That's really important because it means that one radiologist opposed to two without the AI would need to diagnose, which is really important in terms of freeing their time up. And I see that technology can create efficiency, but also mean that clinicians can spend more time with their patients. Okay, so I think AXREM can help in terms of workforce. We already work really closely with many of the societies and colleges within our space, and those relationships are really important. And as I've said this morning at this event, technology is really important in terms of creating efficiencies. We see AI, we see automation, and we also see online education and training. And I think industry also has a role to play in terms of education and training, so that the workforce feel like they're being upskilled, and that is much more will create much more retention within the workforce if they feel like they are continually learning and upskilling. So my top tip to help people scale up their technologies within the NHS is to connect to the NHS, to the events like this, come and meet the clinicians that can go back to their trusts and talk about your technologies. It's all about education, information. Being part of AXREM really helps in getting the message out there about your innovations and technologies. We champion that, we champion your companies and the innovations and the technologies that you're able to deploy and upscale within the NHS.